3rd to 8th week, the embryonic period. The embryonic period, or period of organogenesis, occurs from the 3rd to the 8th week of development and is the time in which of the three germ layers, ectoderm, mesoderm, and endoderms, gives rise to a number of specific tissue and organs. By the end of the embryonic period, the main organ system has been established, rendering the major feature of the external body form recognizable by the end of the 2nd month. Fetal period, from the beginning of the 8th week till the birth, in which all organs grow and mature. Number 1. The length of the fetus is usually indicated by crown rump length, CRL, sitting height, or the crown heel length, the measurement from the vertex of the skull to the heel in standing height. Fetal period. These measurements expressed in centimeters or correlated with the age of the fetus in week or month. Few birth defects may occur in this period, and among these are defects of the central nervous system. This table shows you the age per week, CRL centimeter, and the weight occur in the corresponding weight. For example, 2 to 12 week of age, the CRL will be 5 to 8 centimeter, the weight 10 to 45 gram. At the age of 37 to 38 week, near the labor, the CRL will be 35 to 36 centimeter, and the weight of that fetus will be 3 kilos or 3 and 400 grams, 300 and 400 grams weight. The growth in the length is particularly striking during the 3rd, 4th, 5th month, while the increasing in the weight is mostly striking during the last 2 months of gestation. In general, the length of the pregnancy is considered to be 280 days. We have to go back to refresh. The growth in the length is particularly striking during the 3rd, 4th, 5th month, while the increase of the weight of that fetus embryo striking during the last 2 months. Now, either the gestation 34, 38 or 40 weeks after the onset of the last normal menstrual period, LNP, or more accurately, 266 days or 38 weeks after fertilization. For the purpose of the following discussion, age is calculated from the time of fertilization and is expressed in week or calendar months. Staging of human embryo. Number 1. Counting the number of somites. Measurement of the crown rump length. Measurement of the crown heel length. The growth in the length is more clear during the 3rd, 4th, 5th month, while increase in the weight is clearly measured at the last 2 months of development. Question number 1. We have to answer these questions. An ultrasound at the 7th month gestation showed too much species fluid accumulation in the amniotic cavity. What is the condition called and what are its causes? The answer: an excess amount of amniotic fluid is called hydrominous or polyhydrominous, and many times, about 35%, the causes is unknown idiopathic. A high incidence, 25%, is also associated with maternal diabetes and with birth defect that interfere with the fetal swallowing, such as esophageal atresia and anencephaly. Question number 2. Later in her pregnancy, a woman realized that she was probably exposed to toluene in the workplace during the third week of gestation, but tells a fellow worker that she is not concerned about her baby because the placenta protect her infant from toxic factors by acting as a barrier. Is she correct? Answer: no. She is not correct. The placenta does not act as a complete barrier, and many components cross freely, especially lipophilic substances such as toluene, alcohol. Furthermore, early in pregnancy, the placenta is not completely developed, and the embryo particularly vulnerable. These early weeks are also very sensitive to insult by compounds such as toluene, which cause toluene embryopathy. Counting the date of birth. Birth occurs 40 weeks after the onset of last normal menstrual period, LNP. This period is equal to 280 days. Also, this period is about 266 days or 38 weeks after fertilization. Obstetricians calculate the expected date of birth as 7 day minus month from the date of the last LNP. This method is accurate if the cycle was regular 28-day duration. Counting the date of birth also, miscalculation may occur in the presence of an irregular cycle or due to the false menstrual occurring due to the bleeding from the lacunar stage of blood flow at the day 13 after fertilization. Such occurrence before the date called premature birth, while birth later than this date is called post-mature. Usually, fetal age is determined by combining the data of the LNP, the length, the weight, the external morphological feature of the fetus. The determination of expected delivery date by the ultrasound examination is much helpful by using the CRL measurement measured especially during the 7th to the 14th weeks. Determining of the expected delivery dates by ultrasound is much helpful by parietal diameter of the skull, which is done at the day of the week 16 to 30. The ultrasound measurement also done for circumference of the head and the abdomen. and for measurement of the length of the femur. The main external feature of embryo and fetus. Features at the first month, the presence of embryo somites, the pharyngeal arches. Features of the second month, CRL about 30 millimeter, large head with ears and eyes on the side, nose is seen, limp bud formation, large swallowing of developing umbilical cord. Features of embryo at the third month, head 1.5 CRL, face is more human-like, primary ossification center seen along the bones and the skull. Fetal sex could be determined by ultrasound at this period. Withdrawal of intestinal loop in umbilical cord is inside the abdominal cavity. The limb reach their relative length in comparison with the rest of the body, although the lower limb are still a little shorter and less well developed than the upper extremities, as is shown in these figures in relation with the umbilical, upper limb, lower limb, head circumference, presence of the eyes, and facial skeleton. Features of embryo during the fifth month. Now, the CRL is 1/3 of crown heel length. CRL is about 15 centimeter. Weight is increased up to 500 grams. Fetus covered with lanky hair, white hair. Eyebrow and head hair are visible. Fetal movement are clear and easily felt by mother. Features at the sixth month. The skin is red, wrinkled, with no subcutaneous connective tissue. All the organs are functioning but there is no coordination between the central nervous system and the respiratory system. Therefore, aborted fetus is very difficult to survive. Fetus of the 7th month is able to survive with difficulty. The CRL is about 24 centimeter. The weight is about 900 grams. Now the features of the last 2 months. The fetus well rounded by deposition of subcutaneous fat. CR about 31 to 40 to 34 centimeter. Weight increased markedly to about 1,400 to 2,900 grams. This figure shows you the different general features of the embryo with different ages. 3rd month, 5th month at birth. In this measurement, we can see the circumference of the head, which form and related to the body. 1/5, 1/3, 1/4 of the body measurement. The fetus, when it's born in the 6th month, has a great difficulty to survive. Although several organs are able to function, the respiratory system and the central nervous systems are have no differentiated sufficiency, and so coordination between these two systems is not yet well established. By the 6th to the 7th month, the fetus has length is about 25 centimeter, weight approximately 1 kilo, 1000 gram. If born at this time, the infant has about 90% chance to survival. Some developmental event occur during the first 7 months is indicated in the development. Now, the developmental horizon during the fetal life. Test past appear, swallowing, respiratory, suction, some of sound can be heard, the eye sensitive to the light. In related to the weeks, so different. Now, fetal membrane and placenta. The placenta is an organ that facilitates nutrition and gases exchange between the maternal and fetal compartments. As the fetus begins the 9th week of development, its demands for nutritional and other factors increase, causing the major changes in the placenta. Foremost among these is an increase in the surface area between the maternal and fetal component to facilitate exchange. The deposition of the fetal membrane is also altered as production of amniotic fluid increases. Now, changes in the trophoblast. The fetal component of the placenta is derived from the trophoblast and extra embryonic mesoderm chorionic plates. The maternal component is derived from the uterine endometrium. By the beginning of the 2nd month, the trophoblast is characterized by a great number of secondary tertiary villi that give it radial appearance. This figure will summarize our talks. The stem, the anchoring villi, extend from the mesoderm of the chorionic plate to the cytotrophoblast shell. The surface of the villi is formed by syncytium resting on a layer of cytotrophoblast that will in turn covered by a core of mesoderm, vascular mesoderm. The capillary system developed in the core of the villi system soon come in contact with the capillary chorionic plate and connecting the stalk. Thus it gives rise to the extra embryonic vascular system. Development of the placenta. Definition. The development of the placenta by villus structure of embryoblast as following: primary, secondary, tertiary. The primary at the 2nd week, the tertiary villi 3rd week, and the 2nd week the third tertiary villi at the 3rd week end. So that there will be a primary villus. We will see the cytotrophoblast in the inner aspect, and the outer is syncytiotrophoblast. B, there will be secondary villi corresponding to core, containing mesodermal core, and surrounding by well-developed layer of cytotrophoblast and the outermost syncytiotrophoblast. The tertiary villi is formed by vascularization, formation of vessels in the core of the mesoderm, and disappearance of the cytotrophoblast. These three figures show you the primary, secondary, tertiary villi. As in the underlying figures with developments of placental circulation. During the following month, a numerous of small extension sprout or develop from the existing villi system into the surrounding lacunar or intervillous spaces. Initially, these newly formed villi are primitive, but by the beginning of the fourth month, cytotrophoblast cells are and subconnective tissue cells disappear. The syncytium and endothelial wall of the blood vessel are then the only layer that separate the maternal and fetal circulation. Frequently, the syncytium become very thin, and large pieces containing several nuclei may break off and drop into the intervilli blood lake. These pieces, known as syncytial nodes, enter the maternal circulation and usually degenerate without causing any symptoms. This appearance of the cytotrophoblast cell progress from the smaller to the larger villi, and although some always persist in large villi, they do not participate in the exchange between the two circulations. Chorionic vindosum and decidual basalis. In the early week of development, the villi cover the entire surface of the chorion. As pregnancy advances, villi on the embryonic pole continue to grow and expand, giving rise to the chorionic fundosum and bushy chorion. Villi on the embryonic up embryonic pole degenerate, and by the third month, this side of the chorionic, now known as chorionic leaf, is smooth. At the third month, chorionic fundosum, as shown in the figure, bushy chorion, chorionic leaves, the mucosa decidual, subdivide into decidual basalis, which is filled with loaded with lipid and collagen. Decidual capsularis, then decidual parietalis. Now, as the chorionic leaf is removed, the difference between the embryonic and the upembryonic pole of the chorion is also reflected in the structure of the deciduum. The function layer of the endometrium, which shells during the parturition, the decidual over the chorionic fundosum, the decidual basalis, consists of compact layer of large cell. The decidual cells is bounded amount with lipid and collagen. Development of the placenta. Formation of the outer cytoplastic shell and at the third week, stabilizing implantation firmly. The endometrial mucosal function for implantation is called deciduous. stem villi or anchoring villi, free villi or terminal villi. These villi grow in the lacunar space of the syncytium, which are filled with the maternal blood and are therefore called intervillous spaces. This layers, the decidual plates, is tightly connected to the chorionic so that the decidual layer over the embryonic pore is the decidual capsularis. With the growth of the chorionic vessel, these layers become stretched, degenerate. Subsequently, the chorionic leaf comes in contact with the uterine wall, decidual parietalis. Now, that is what we call it cross section of placenta. Two umbilical vein, one umbilical artery, chorionic plates, interchorionic interspaces, endometrial arteries, and so on. Now, development of the placenta. This at the second month of developing. At the third month, chorionic fundosum, oshicorion, chorionic leaf, as we discussed. Then enlargement of gestation, obliterate the uterine cavity, but still visualis, decidual capsularis, and decidual parietalis can see, but after this fusion, decidual capsularis degenerate in fusion with chorionic leaf and decidual parietalis and amniotic. Thinning of the villi wall begin at the fourth month. Parietal disappearance of the cytoplasmic cell and the extraembryonic mesoderm of the tertiary villi, we call it the terminal villi, that are functioning in the feto-maternal exchange. Placental barrier, only endometrium of the villus. Development of the placenta. Thinning of the placenta again begin at the fourth month. Parietal disappearance and cytotropoplastic cell and extraembryonic mesoderm of the tertiary villi that are functioning in the feto-maternal exchange. Syncytial notes placental barrier, only 2% endothelium of the villus vessel and syncytium. Now, the barrier formed by syncytium, cytoplasm, connective tissue, endothelium. In the pregnant lady, barrier is formed by syncytium, cytoplasm, and endothelium. Placental barrier, only 2 endothelium of the villi vessel and etc. And we can make a distinguishing between the two, C and D. Now, by the beginning of the fourth week, placenta is formed by two components, chorionic and decidual basalis. enlargement of the amniotic cavity, filled the extra-embryonic chorionic cavity, fused with the amniotic membrane with one sac with extra-embryonic chorionic plates, amniochorionic membrane that surround the developing fetus. Placenta tissue. This figure shows you the placenta tissue arranged chorionic plates, basal plates, chorionic plate, basal plates, and the intervillous spaces. Formation of cytocotyledon. Formation of the cotyledon is the main units of exchange blood, maternal and fetus. At the 4th to 5th month, many mucosa or decidual side separated septes protect into an intervitral space. The septum maternus cover the syncytium. Cotyledon is about supplying the fetus by 80 to 100 maternal spiral artery, accomplished by endovascular invasion by the cytoprophoblast. The intervillous spaces are filled with about 150 ml of blood that is replenished 3 times per week. As a result, continuous growth of the fetus and enlargement of the uterus placenta will be enlarged in 5%. The increased thickness of the placenta is due to increase in arborization of the villus and not to be more penetration of the villi. Now, features of full-term placenta. It's very important to summarize these features. As fetal site, first of all, maternal site, then fetal site. Maternal sides show you different maroon in color. See decidual basalis. Cotyledon here separated by groove by decidual basalis. The umbilical cord is usually eccentric or at the margin. Rarely the cord is attached to the chorionic plate, not to the placenta. It's called filamentous inserting cord. Filamentous inserting cord. At full term, at the end of the pregnancy, the villus show different characteristic features. Transmission of maternal IgG antibiotic that begin to be transported to the fetus approximately 14 weeks and thus provide passive immunity for the fetus against some infection disease, except chicken pox and whooping cough. These passively immunized supporting a newborn for a short time after birth. The newborn begins to produce their own IgG, but by the level of adult not until the age of 3 years. Fourth, hormonal detection or production. Estradiol, one of the hormones, and to act on the uterus. Pre-isoimmunization. as in now the umbilical cord and the amniotic. The development, the cephalocaudal and lateral folding of the embryonic disc during the second month of development lead to formation of the ring at the junction of the amniotic and the ectoderm. This is called the primitive umbilical ring that contain the following: connecting stalk, vitellinear duct, canal connecting the intraembryonic cavity with the extraembryonic cavity. The amniotic cavity is enlarged to fill the extraembryonic at the end of the third month of pregnancy. This will lead to compression and obturation of the yolk sac in the chorionic cavity. Also, enlargement of the amniotic compressed the content of the primitive umbilical ring and enclosed them to form the primitive umbilical cord, which contain number 1, distally the vitellinear ducts and umbilical vessel, proximally atlantoids and umbilical vessels. Then will be discussed the atlantoids and atlantics and the vessels obturation. In full term umbilical cord, therefore, the mature cord containing only umbilical vessels surrounding by a proteoglycan material called Wharton's gel that protect the vessel. Feature of normal full-term umbilical cord summarized: number 1, number 2, number 3, and feature of normal amniotic fluid also summarized in the number 1, number 2, number 3, number 4, and 5 structures or characteristic features. Feature of normal amniotic fluids: 1, 2, 3, 4. Now, another subject we call the twins or dizygous twins. These figures show you the characteristic feature of these twins. Either two-cell stage or at inner cell mass or at the bilaminar germ disk, the type of the twins. This is monozygous twins. Twin defect will create the following features. You have to summarize. Parturition is another process of delivery which is in stages, occur in stage, so you have to summarize it.